Welcome to Therapy Facts with Dr. Jenn. Point number 5 about how to start therapy is related to how to pay for therapy. So, if we start with the employee assistance programs, the student assistance programs, the personal assistance programs, those programs may offer free therapy sessions. So, your first couple of therapy sessions may not cost anything to you, right? The second source and the largest source for therapy payment is health insurance. So you may have health insurance that provides a particular payment for mental health services depending upon your whatever your insurer or wherever your employer wanted to provide. Your employer or your insurer decided to provide. So you can have a situation where you are responsible for a copay, and so that the health insurance pays the majority of the cost for therapy, which can be as much as $200+ per hour. You may have a situation where your health insurance pays $180 of that cost for you, and you have a copay of maybe $20, or you may have a copay of $50, or you may have a copay of $75. So it just depends. But the health insurance will pay at least some part of the fee, and then you have a copay. The next level of pay would be self pay, where you find a therapist who accepts self pay, and you may pay as much as the $200 an hour yourself, or very often therapists who accept self pay, they try to mirror the cost, their out of pocket costs to the client to match whatever their copay may have been if they had insurance. And so, for example, if the typical insurance copay for a state is $75, you might find a therapist who is willing to charge $75 an hour, especially a master's level therapist, who is willing to charge $75 an hour in order to avoid the whole process of going through insurance, because that is a big burden on smaller therapists. And so you may find private therapists who may be privately employed therapists who may be willing to take something similar to whatever your copay would have been with a health insurance company. Now, there are also therapy options at medical facilities which would provide a sliding scale. So you may find therapy options at, say, the public health center in your state or your municipality. You also may find sliding scale pay for therapy services at your state or federally funded medical facilities, outpatient clinics that may provide therapy for a sliding scale fee as well. And so, again, there's a number of ways that you can get access to professional therapy services that require from no pay to sliding scale pay to health insurance to self pay. And so, with those different options, you have a better opportunity to get to therapy and get your needs met. So don't let concern about how will I pay for therapy. Don't let those concerns stop you from getting started in the process of finding a therapy situation or a therapy partnership that will work for you.